Hello guys, a very good evening to all of you. I welcome all of you to today's session of INICET Pharmacology. And guys, I could not do the session on last Sunday and yesterday because I was busy with some work. But anyways, I'll make it up for whatever we could not do in the last 2 weeks. Today, we'll be discussing the questions of CVS and CNS followed by antimicrobials. So whatever we were supposed to discuss on the last 2 Sundays, we will discuss it today. But anyways, the most important part, of this exercise is not what we do on Sundays. The most important part of the exercise is from Monday to Saturday. Now, some students, they have asked me, so one doubt I'll just clear for some students who they have messaged me that once the NEET PG exam was over, it was as if someone released the air of confidence and hard work inside them. They are deflated, I mean to say. And how to come back? See, if you're not able to revise your notes, go back to your notes, then it is fine. What you need to do is do at least something. So study retrogradely. Now, what is retrograde? Do the PYQs, and while you do PYQs, whatever relevant topics notes are there, you can go back to them. So guys, I hope all of you are doing well. Good evening to all of you. Shoaib Khan, Vikas Gujjar, good evening to all of you. So let us begin with today's session, guys. So, see, weekly pharmacology. Today, our aim is to cover CVS and CNS followed by antimicrobial drugs, right? So, let's begin with question number 1. I won't waste much time. So, this is a question of INICET November 2022, right? An antiarrhythmic drug was shown to have the following effect. It is effective both in atrial and ventricular arrhythmias. Identify the drug. It's a very simple MCQ. It was recently asked. Come on, guys. Come on. All of you must answer. All of you must participate. It is not a difficult question. It's an easy one. And in fact, if you remember in antiarrhythmics, I've told you time and again, there are only 2 things which are commonly asked. There are 2 things. Come on, guys. Come on. All of you must comment. What is the answer? What is the answer? You gave an antiarrhythmic drug. So this black one is the graph, normal ventricular graph. This one is the graph when I gave the drug, right? When I gave the drug, this is the graph that I got here. So in this case, yes, come on, guys, come on. What is the answer? What do you guys think is the answer? A, excellent. A is the right answer. And see what quinidine does. Why this delay? This is delay in repolarization. It is because of potassium channel block. And potassium channel block causes a delay in repolarization. It is seen with 2 classes, class 1A and class 3. 2 classes, class 1A, class 3. Excellent, guys. Most of you have given the right answer. Class 1A and class 3. And in class 1A, if you remember, I've told you time and again, they ask mostly about only one drug, that is quinidine. So if you cannot remember, at least remember Q for quinidine. Q for quinidine. So going ahead for any exam, whenever you look at antiarrhythmic topics, you should know 2 things. 1, drugs which cause QT prolongation. Number 2, side effects of amiodarone. These 2 things, if you know in antiarrhythmics, you'll probably do all the questions right, plus some of DOC, like what is the drug of choice for acute attack of SVT, PSVT, adenosine, etc. Excellent. INICET November 2022. Next question, guys. Match the mechanism of action of the antiarrhythmic drugs. Now, see, this is the match. This is the match. So, just try to find the answer. So, in these questions, usually what I have seen is the matches are not difficult. I mean, it's an easy one. The only difficult thing is you have to find the right match and make. So it's kind of 4 questions in 1 question, right? 4 questions in 1 question. So what is the answer here? So it's an easy one, isn't it? D is the right answer. As I can see, most of you have given the answer right. D is the right answer. So A4. So digoxin, digoxin is a sodium potassium ATPase blocker. Abutylide is a potassium channel blocker. Asmolol is a beta blocker. Quinidine is a sodium channel blocker. So as you know, this is the very basics in pharma. This is the very basics in pharma. Such questions are no longer asked. For example, they'll not ask you asmolol is what, right? But here they're asking is because here is match the following. Right, so there is a little bit increase in the difficulty level. All right, moving on to the next question, guys. Which of the following is false statement regarding statins? It's again a question of INICET November 2022. So November 2022, there were 2 sessions, and that is why the number of questions are more. All right, option number A. Although HMG coenzyme reductase inhibitors substantially reduce risk of cardiovascular events, there is a mild increase in lipoprotein A, one option. This drug should not be stopped even in severe conditions like injury, surgery, etc. It can be given with verapamil and other enzyme inhibitors. With long-term use, there is a slight increase in incidence of type 2 diabetes mellitus. All right, guys. Again, this is not a difficult one. And you see, a lot of times in a question, you might not have idea about all the 4 options, and you need not have. Because if you know at least one option which is right or wrong, many times you'll be able to find the answer, right? And it's again such type of MCQs they have been asked. I'll give you an example of PYQ they had asked. The PYQ was which of the following antibiotic should not be used with rosuvastatin, they had asked. Which antibiotic should not be used with rosuvastatin? This was the MCQ they had asked. And in that your answer was clarithromycin. So all of you know that statins like rosuvastatins are metabolized by cytochrome P450 enzymes. Clarithromycin is an enzyme inhibitor. So if you would have solved this MCQ, a basic point why we are not using it, it is enzyme inhibitor, you would have landed on the right answer, that it can be given with verapamil and other enzyme inhibitors is a false option. So yeah, excellent. So they had asked you this MCQ, and I'm happy that you guys remember. All right. Now try to understand this. Now, if I solve this MCQ, if I have solved this MCQ, whenever you prepare for ionized set, the options are itself an MCQ point. For example, they'll ask you which of the following is or is not an effect of statins. An increase in lipoprotein A is an important point. They will ask you increase in lipoprotein A. So whenever I give statins, they will decrease LDL, they will decrease VLDL, they will decrease triglycerides, they will increase HDL, and they will increase lipoprotein A. So this is what I must remember. Because this is one MCQ they can ask from this option, right? Again, they can ask you about this option. If there is an injury or if there is surgery, you might think about myopathy. But myopathy, remember, myopathy is not an immediate side effect. I've taught you this. Myopathy is a delayed side effect. It would be seen after many years. So if there is an injury, there is nothing to be worried about because it won't cause myopathy. So here, the surgery or the injury is related to myopathy. Long-term use, there is a risk of type 2 diabetes mellitus. Now it is important. What does it mean? Now tell me one thing. It increases the risk of diabetes mellitus type 2, that is true. Now if I ask you, statins are used in, if I ask a statement, statins are used in diabetes mellitus. Now what do you think? Answer me, is it a true statement or a false statement? I'm asking you from this because many times we might get the inference wrong. So I'm asking you, is it true or false? Statins are used in diabetes mellitus. True or false? Statins are used in diabetes mellitus. It's a true statement, guys. It's a true statement. Why I'm asking this? Because though they increase the risk of diabetes mellitus, they are still used in diabetes mellitus, right? The reason being, they will worsen, they might cause hyperglycemia because of insulin resistance, but the good thing is they decrease cardiovascular mortality like MI and stroke. So, in pharmacotherapy, 2 things are important, benefit and risk. So what is more here? Benefit is more. Excellent, guys. Excellent. Very good. Now, next one. Look at this. Again, it's a question of ionized set November 2022, and it's a difficult one. Now, such questions, if you're not able to solve in the exam, it's okay. Some questions would be difficult, which all of us cannot solve. So look at this lipid profile of a patient who suffered from acute coronary syndrome. See, this is the catchword. LDL is 127, HDL 32, triglycerides 278. Which drug is used to treat this condition? Right. Which drug is used? Now see, atorvastatin 80 mg is the answer, as most of you have given. Now let me tell you this here. You need to see, this is an MCQ they've asked, and this is called as statin intensity. Now, statin intensity therapy, clinically there are 2 intensity which are used. Two types of intensity which are used: statin intensity, moderate, and high intensity. Say moderate intensity statin therapy is, I'll be using rosuvastatin around 5 to 10 mg, atorvastatin 10 to 20 mg. High intensity rosuvastatin is around 20 to 40 mg, and atorvastatin 40 to 80 mg, right? Now see, this is two intensity. Low intensity is not preferred because the benefit is not much. Now, intensity means clinical case of ASCVD. What do you mean by clinical case of ASCVD? Who already has an attack of MI or unstable angina or stroke, let us say, right? So these are clinical cases of ASCVD. Or in case the LDL level is more than equal to 190 milligrams per deciliter. Here, there must not be, I just changed it. This high intensity is for this one. So I just switched it. So high intensity is for this one, whereas moderate intensity is I'm going to use when there is no clinical case and the LDL level is less than 190. So I just switched it. So high intensity, which means what? If you go to this question, I told you earlier, the catchword is this acute coronary syndrome. So it's a clinical case of ASCVD. In this case, I can use 40 to 80 mg of atorvastatin, whereas I can use, you can see here, high dose, I can use 20 to 40 mg of rosuvastatin. So rosuvastatin 10 mg is not the right answer because I need 20 to 40 mg in this case. So they have asked this MCQ. Now you must be prepared. You must be prepared for other types of MCQs where they can ask you. They might ask you, they might not give you a clinical case. They might play with the LDL level. So even if there is no clinical ASCVD, but LDL level is, let us say, 210 or 220 or 250, in that case, automatically I'll go for a high intensity statin therapy, right? See, you have to understand. Someone's asking, sir, but LDL level is not more than 190. This is not and, this is or. You know my point? Or. Clinical case of ASCVD, or if there is no clinical case of ASCVD, but only LDL is more than 190. You have to understand, this is or. The important catchword is or, right? Is not and. I don't need both. Because in this case, see, there is no clinical case, right? All right, got the point, right? Now, gallstones are seen as a side effect that can be seen with, come on guys, come on. Gallstones are seen with two important classes of drugs which they ask in your exams, and I've told you about them. Gallstones as a side effect can be seen with which drugs? So, I said November 2022. Gallstones can be seen with which drugs? A, B, C, D. Gallstones can be seen with which drugs? Right, very good guys. Gallstone can be seen with PPR alpha agonist. In other words, this is something we have discussed, fibrates. So gallstones as side effect. I've asked you to remember two classes of drugs, fibrates, and do you remember the second one? Octreotide. So two drugs which are commonly asked in your exam, which can cause gallstones, both have been asked. See, fibrates, they have already been asked, is being repeated now. It's an easy MCQ. Excellent guys, most of you are correct. Now moving on to the next question. A 57-year-old man was brought to the hospital with complaints of dizziness and breathlessness. He has history of intake of amiodarone, metoprolol and all other drugs. Physical examination following discoloration over his face. Which of the following is the likely responsible? INS at November 2021. It's an easy one, guys. It's an easy peasy one. I told you to remember two things in CVS antiarrhythmic. One, drugs causing QT prolongation, quinidine. At least that much. Second, side effects of amiodarone. So here, amiodarone is the right answer. And what you see here, it is called as ceruloderma, or it is the blue-gray pigmentation. Now, what you need to understand is this ceruloderma, it is seen on the sun sun exposed area. It is seen on the sun exposed area, that is, you can see on the face. Now, this is one type of pigmentation. Second type of pigmentation that is seen with amiodarone is called as photosensitivity. And photosensitivity is brown pigmentation, and that is also seen in the sun exposed area. Now, out of these two, ceruloderma and photosensitivity, both can be seen. Which is more common is photosensitivity. And what we advise the patient to apply lotion, to use umbrella or to cover up before they go out in the sunlight. So this is an easy one, guys. Now, no. Blue syndrome is not due to photosensitivity, guys. Photosensitivity is actually, in photosensitivity, they will give you brown pigmentation, right? Ceruloderma is something like photosensitivity, but it is not exactly photosensitivity. Photosensitivity is the second part. All right, let's move on to the next question. INI said November 2021, for the diagnosis of resistant hypertension, there should be elevated blood pressure despite patient being on 3 antihypertensive medications. They should include at least one. This has been asked in all examinations across India many times. Many examinations across all, right? Many examinations across all they've asked. So which one is it? So there should be right, decreased responsiveness to at least three drugs, and one of them, it must be a diuretic. One of them, it has to be a diuretic. One of them has to be a diuretic, right? So D is the right answer, guys. And tell me, what is the drug of choice for resistant hypertension? It is resistant hypertension. What is the drug of choice in resistant hypertension? So if they ask you, this is the case, what am I going to use for treatment? Which drug would be used for treatment of resistant hypertension? Which drug am I going to use for treatment of resistant hypertension? Which drug am I going to use? Very good. Very good. I'm going to use spironolactone. I'm going to use spironolactone for treatment of resistant hypertension because aldosterone is high. We have discussed that. Move on. Now coming to CNS questions. INI said May 2022, ACTH is used in treatment of. ACTH is used in treatment of. See, ACTH use, it has been asked quite in these times, right? ACTH, what is the use of ACTH? West syndrome. So West syndrome, guys, this MCQ has been asked in different ways. West syndrome, you can see infantile spasm, or it is also known as salam spasm, right? Due to contraction of the upper and lower limb, it seems as if the infant is doing a salam, right? So the MCQs which they ask ACTH, it is either West syndrome or infantile spasm or salam spasm, whatever is there. Your answer is ACTH, and it is again not a difficult MCQ because it has been repeated time and again, right? Yeah, excellent. If it is associated with tuberous sclerosis, I use vigabatrin. Specifically, if tuberous sclerosis is mentioned, then I'll use vigabatrin. Topiramate is used for. Is an INI said June 2021. Topiramate is used for. Come on, guys. What is the use of topiramate? What is the use of topiramate? If they ask just what is the drug of choice for absence seizure, then in that case, go for ethosuximide. That will be better answer. Go for ethosuximide. Right. So what would be the answer here? All right, guys. Treatment of Lennox-Gastaut syndrome. Now remember here, it is not used for treatment of migraine. It is rather used for prophylaxis of migraine. It is used for prophylaxis of migraine. So this is Lennox-Gastaut syndrome. Lennox-Gastaut syndrome. You must know the drugs used in LGS. One, the most preferred drug or the drug of choice, it is undoubtedly valproate. It has been asked. Then I can also use topiramate. I can also use rufinamide. And finally, I can also use lamotrigine. So these are 4 drugs that I must remember. Right? 4 drugs that I must remember, which are the main drugs. If they ask you which is the least effective, If they ask you which is the least effective drug in LGS, your answer would be lamotrigine. So remember these drugs of LGS, it is an important drug. See, felbamate and all, they can be used, but felbamate is mostly used for GTCS and partial seizure. Felbamate is mostly used for GTCS, partial seizure. In Lennox-Gastaut syndrome, we can use some benzodiazepines, but their status is mostly for add-on drugs. These are the most important drugs which are used in LGS. Next question, guys. INI set May 2022. INI set May 2022. A 42-year-old presented to the emergency with ALT, AST, both are raised. GGT is raised, means is alcoholic. Altered sensorium and seizure. Which of the following drugs should be used to stabilize the patient? Lorazepam, diazepam, alprazolam, clonazepam. This is again, this is a very, very commonly asked MCQ, and in fact, this is the only thing they ask about benzodiazepine, right? Load drugs, right? That is lorazepam, oxazepam, temazepam, and astazolam. So these load drugs, these are excellent, guys. These are the drugs where one they ask you, there are three type of MCQs. Liver failure, number one type of MCQ, liver failure. Which one would be preferred in elderly? Second MCQ, which drug has no active metabolite? Which drug is metabolized by direct glucuronidation? So you can see there are different ways. There are different ways of asking the same MCQ. Now, if I just mug up that if there is liver failure or ALD and I'm gonna use lorazepam, if I remember only this much and this MCQ, this particular topic is repeated, I might not be able to solve it, right? See this question. See what happens is, if there is, in this case, you see the patient already has ALD, right? Altered sensorium and seizure. Is a patient of, so here mostly the patient might go into liver failure, or it is a decompensated liver. Whenever the patient has liver failure, I go for load drugs, or these are called as short acting benzodiazepines. Why do I go for these drugs? Is the reason being, these drugs, these are metabolized in phase 2 only. Phase 2 only by direct glucuronidation. They don't require phase 1. So these load drugs, they go into phase 2 and directly get changed or transformed into water soluble form. Other benzodiazepines would be metabolized by phase 1, phase 2 both. Like diazepam would require both phase 1 and phase 2. So in liver failure, which benzodiazepine I'm going to use? Any benzodiazepine that would have lesser work done by the liver. So liver को कम काम कौन करवाएगा? Will let the liver work lesser. कौन काम कौन करवाएगा liver से? यही करवाएंगे. That is the reason why. So again, I have told you this, guys, right? Is not about half-life. Anu, it is not about half-life. It is not about half-life. It is about direct metabolism in phase 2. I have told you this, guys, right? Direct metabolism phase 2. That is the reason. Alright, which benzodiazepine is used in alcohol withdrawal? Diazepam, lorazepam, clonazepam, alprazolam. Which benzodiazepine is used in alcohol withdrawal? Which one would you use, guys? What is the answer? Alcohol withdrawal. Which benzodiazepine is used? Here, see, better answer is diazepam. Diazepam is the better answer until and unless they have mentioned that it is seizure, and if there is seizure, in that case I might go for lorazepam, specifically if there is liver decompensation. Otherwise, alcohol withdrawal, we go for benzodiazepines, and the benzodiazepine of choice is diazepam or chlordiazepoxide. Now this is more preferred. If they give you diazepam and chlordiazepoxide both, go for chlordiazepoxide because it is longer acting than diazepam. It would become a better answer. Chlordiazepoxide would be a better answer, right? Which of the following is a novel antidepressant? Which of the following? So INI set November 2021. Which of the following is a novel antidepressant? Come on, guys, what do you think is the answer here? Lurasidone, vilazodone, asenapine, meancerin. Which of the following is a novel antidepressant? Excellent, very good guys. Vilazodone is the right answer here. So Vilazodone, it's an SSRI plus it is a 5-HT1A agonist and it is used for treatment of major depression. SSRI 5-HT1A agonist. There is another drug called as vortioxetine. It is an SSRI. It is 5-HT1A agonist, 5-HT1B, 1D antagonist, 5-HT3 antagonist, 5-HT7 antagonist. Now, don't worry, you don't have to mug up all of these. But there is a reason why I'm telling you how it acts. Because of this, it is called as MSAA, MSAA antidepressant. Now, this will be the future MCQ. MSAA. MSAA means what? Multiple serotonin agonist antagonist. So, it is an agonist and antagonist at multiple serotonin receptors. And that is the reason why it is called as MSAA. Now, if you remember, there is an MCQ that asked you which is a NASA antidepressant. And NASA antidepressants is mirtazapine. It has been asked. NASA antidepressant, it is mirtazapine. It is noradrenergic specific serotonergic antidepressant, right? NASSA, NASA, noradrenergic specific serotonergic antidepressant. This has been asked. This already has been asked. This is something they will ask you, which is MASA. So there was NASA, now it is MASA. MASA is SSRI, 5-HT1 agonist, antagonist, right? And understood, guys? Yeah, so that's they have asked. So Vilazodone they have asked now. Vortioxetine they can ask. Now see, suppose this is the same question. Same question, let me change this. Which of the following is a novel antipsychotic? I've just changed the MCQ. See, I've changed the MCQ. See, keep in mind, this type of change or mutation in the questions, it is done by the AIMS guys. AIMS guys, they'll change the question slightly, one word, and the next time you think it is a repeat, but it is not. It is not a repeat, right? So I've changed the question. Which of the following is a novel antipsychotic? So I've just slightly changed the question. I've changed just one word. And if you would have mug up the, so that is one reason why I told you, don't mug up the PYQs, right? Don't mug them up. Which of the following is a novel antipsychotic? Novel antipsychotics are all atypical, dear. Novel ones are atypical. There is no typical novel ones. Right, so here your answer would be, if this is the MCQ, your answer would be lurasidone. And lurasidone is a sibling of ziprasidone. And what is good about lurasidone, ziprasidone, they do not block the other receptors. They do not block other receptor. Block is not seen. Now you remember I have talked about other receptor, muscarinic, H1, 5-HT, alpha 1. So these lurasidone or ziprasidone, these are weight neutral, plus they do not cause metabolic side effect. Metabolic side effects like hyperglycemia, dyslipidemia, plus weight neutral. So these drugs, so if you remember antipsychotic, the novel ones, aripiprazole, brexpiprazole, cariprazine, ziprasidone, lurasidone, these are novel antipsychotics. The reason being, they do not cause weight gain, plus they do not cause metabolic side effects. That's a good thing. Alright guys, excellent. Now moving on to INICET May 2022 question. A female presented with history of hypomania. She had another episode recently and is planning for pregnancy, right? Which of the following is most teratogenic drug? Which of the following is most teratogenic drug? Lithium, valproate, olanzapine, oxcarbazepine. Lithium, valproate, olanzapine and oxcarbazepine. So guys, what do you think? What is the answer here? Lithium, valproate, olanzapine, oxcarbazepine. Excellent. So all of you must have solved this MCQ. See, with valproate, valproate is most teratogenic drug. Not only it is the most teratogenic antiepileptic, but also it is most teratogenic anti-mania and bipolar disorder drug, right? So it is most teratogenic both in epilepsy and mania bipolar disorder. Many students, they marked it wrong as lithium. Now lithium can also cause abstinence anomaly. Lithium can also cause abstinence anomaly, and that is the reason why lithium is contraindicated in first trimester. Now remember, but lithium is not as teratogenic as valproate, right? So if there is first trimester of pregnancy, first trimester, mania, I'll be using atypical antipsychotics like aripiprazole. If it is second and third trimester, I'll again use lithium. I'll again use lithium because in second and third trimester, the benefit is more than risk. First trimester, the risk is more than benefit. So I'll be using atypical antipsychotics. Yeah, you have to give folic acid. It is a category D drug. You need to give folic acid, and as it is, see, folic acid needs to be given in every case of pregnancy, isn't it? Next question, guys. INI said May 2022. A patient is on risperidone. He presents to the emergency with upward fixed gaze. Which of the following should be used in management? Upward fixed gaze, right? Upward fixed gaze. So what is the answer? First of all, tell me, what is the answer? What is the answer? Come on, guys, think. Come on, faster. What is the answer? It's an easy question. It's a repeated question. It has been asked multiple times in your exam. For such type of questions, you should not use more than 5 to 10 seconds. It's an easy question. Such questions, 5 to 10 seconds, go for the kill, go for the answer. Save time for the difficult ones. Right, so excellent, guys. All of you are correct. It's a case of acute dystonia. Now see, in acute dystonia, what are the symptoms? Number one, abnormal posturing. So abnormal posturing. What is abnormal posturing? There is contraction of all the skeletal muscles in the body. So the hands will be twisted, legs will be twisted, back would be twisted. There will be back flip of the head. Right. So this is abnormal posturing. Second, that is mentioned in the question, fixed gaze. So there will be fixed gaze. There could be even uprolling of eyeball. Like, so second one is facial grimacing. Someone asked me this doubt yesterday. There could be facial grimacing. What is facial grimacing? It's an abnormal response. Suppose what happens is you get severe amount of pain. For example, your hand comes in between a door or a window. So as soon as the door or window will hit your hand, how will your face become? Like this. So this abnormal facial expression is called as facial gaze. Now there are two things, facial gaze and facial dyskinesia. I mean facial grimacing and facial dyskinesia. Facial grimacing, it is seen with acute dystonia, whereas facial dyskinesia, it is seen with tardive dyskinesia. Right? So abnormal movement. Facial dyskinesia is what the patient will do. He'll keep on moving his tongue out like this, or pill-rolling movement of the lips. So these are called as facial dyskinesia movement, whereas facial grimacing is a painful expression, right? That is seen with acute dystonia. So answer is injection promethazine. Injection promethazine. See why I'm using promethazine, though it is an antihistaminic, it has a very strong antimuscarinic action. And you know that the first generation of antihistaminic, they don't have antihistaminic effect, very less. Most of them, they have a strong antimuscarinic effect, and so they are used in, like promethazine can also be used for motion sickness, Meniere's disease, or acute dystonia. So promethazine is the answer. So guys, here you have to make the right diagnosis, right? You have to make the right diagnosis. INI said June 2021. Which of the following is not an off-label use of risperidone? Which of the following is not an off-label use? You will see what is the meaning of off-label use. There are two types of use, off-label use. Another one is FDA approved use. So a company makes a drug, he goes to the FDA, seeks approval for treatment of the disease, and that is an FDA approved use. What is off-label? When the drug spends a lot of time in the market, because of different correlations, we begin to use a particular drug for a particular disease. Or that is what happens in phase 4 trials, for example. New users can come into the foray. And based upon the phase 4 trials, we can use it, and the company need not go to the FDA. So for example, benzodiazepines have a lot of uses as muscle relaxant, alcohol dependence, this, anxiety, insomnia. But for everything, FDA approval, the company has not sought, and they are called as off-label. So which is an FDA approved use? You understand? Which is an FDA approved use? FDA approved use means what? For that, the company has taken permission. OCD, dementia, bipolar disorder. Guys, your answer is bipolar disorder. Bipolar disorder, it is an FDA approved drug for treatment of bipolar disorder. Right? Not an off-label use means what? FDA approved use. FDA approved use of this is one is bipolar disorder, second one is anti-epileptic. These two are the FDA approved uses, not off-label. Off-label, it can be used in OCD, it can be used in dementia, PTSD, but they are off-label use. The company has not sought permission from the FDA for or approval for selling this drug, right? So answer is C, bipolar disorder. Means इसका मतलब क्या है कि कौन सा ऑफ लेवल यूज नहीं है, इसका मतलब कौन सा एफडीए अप्रूव्ड यूज है. Which is not an off-label use means which is an FDA approved use. Your answer is bipolar disorder. Now just try to understand this. They have asked this MCQ. Now does this mean I'll keep on mugging up all the off-label uses of Risperidone? No, it is not required. Just remember which are the FDA approved uses to bipolar disorder and anti-epileptic uses. That's all, right? Next question, guys. Which is the most efficacious anti-smoking agent? Which is the most efficacious anti-smoking agent? Varenicline, nicotine patch, bupropion, and rimonabant. Which is the most efficacious anti-smoking agent? So this MCQ, it has been asked in your exam. Varenicline is the most efficacious overall. It is the most efficacious anti-smoking agent. If they ask you, second point, based upon efficacy, most efficacious, there are two types of MCQs they can ask. Most efficacious drug, your answer would always be varenicline. Most efficacious nicotine replacement, in that case, your answer would be nasal spray. Most efficacious nicotine replacement. So two MCQs are possible based upon your smoking dependence efficacy wise. Most efficacious drug, varenicline. Most efficacious nicotine replacement, gum, spray, lozenge, etc. Your answer would be spray. Your answer would be spray. Right. Very good, guys. Which of the following is true regarding nicotine substitution therapy? INI said June 2021 question. Which of the following is true regarding nicotine substitution therapy? Yes, guys. What is the answer? Which is true regarding nicotine substitution therapy? Preferably given by gastrointestinal route. Varenicline comes with a black box warning of cardiovascular death. There should be 15-minute gap between nicotine gum and coffee soda acidic absorption. Nicotine chewing gum is better for consistent use and gives a 25% higher blood level than lozenge. Excellent. C is the right answer, guys. C is the right answer. Now see, why this 15-minute gap is given is because your saliva is alkaline. Your saliva is alkaline, and alkaline saliva is important for absorption of nicotine. So if I drink something, even water or even anything or even acidic food, it would remove that alkaline saliva and that would decrease absorption, efficacy would be decreased. That is the reason why this is the answer. Preferably given gastrointestinal route. Why is not correct. Try taking nicotine by gastrointestinal route. You'll have so much severe nausea and vomiting. You'll never go near that nicotine, right? Black box warning of cardiovascular death. See, why it is not correct? It was there earlier, but then it was removed. It was removed by FDA, right? Nicotine chewing gum is better than concentrated use, gives a 25% higher blood level than lozenge. Now, why this is false? See, lozenge, you know what is lozenge? Lozenge is like a toffee. Strepsils, all of you guys must have consumed strepsils. And why the gum has lesser bioavailability than lozenge? Because some amount of drug would remain inside that gum, which you cannot suck everything out. But lozenge, it will dissolve and almost 100%, near 100%, it would be absorbed, right? So, yeah. So, D is also wrong. So, reason, I told you, what is the reason? INI said November 2022, the recent ones. A patient is brought with altered sensorial seizures. Attender shows the laboratory report which reveals elevated transaminases. Which of the following can be used in this condition? So, again, I have just included this because you see, it's a type of repeat, not exact repeat, but it is a type of repeat, and I don't think you should use more than 5 seconds. More than 5 seconds is not allowed to get the answer right here. यहाँ 5 सेकंड में आपको आंसर देना है. चलो जल्दी, come on. What is the answer here? You see, I've just given you this because it has been repeated. It is not an exact repeat, but I told you this is what they most commonly ask about this load drugs. Next one, match the drugs in column A and the contraindications in column B. INI said November 2022. Like, Tell me the answer, guys. What is the answer? What is the answer here? Contraindications. What would be the answer here? What is the contraindication? So A is 4. We know A is 4. A is 4. Amiodarone is 2. Now we are left with 2. Thromboembolism, pregnancy. Thromboembolism. Which one causes thromboembolism? Estrogen causes thromboembolism. Vigabatrin in pregnancy. So what is the answer? A4B1 D2. A4B1. A4B1 C3. A4B1 C3 D2. So A is the right answer, guys. A is the right answer. A is the right answer. Right. So here you might get confused between vigabatrin. Vigabatrin is contraindicated in pregnancy, but thromboembolism. See, some estrogen preparations are also not to be used, but those are older ones like diethyl silbestrol. That is where you might get confused. So A is the right answer. Identify the wrong statement about disulfiram use in alcohol dependence. INS at November 2022. Identify the wrong statement about disulfiram use in alcohol dependence. Wrong statement about disulfiram use in alcohol dependence. Does not stop craving, accumulates acetaldehyde, inhibits alcohol dehydrogenase, starting dose is 250 mg. So which is the wrong statement? So it's not a difficult question, guys. It's an easy one. It's a wrong statement. It inhibits alcohol dehydrogenase is a wrong statement. It does not inhibit alcohol dehydrogenase. It rather inhibits aldehyde dehydrogenase. It inhibits aldehyde dehydrogenase. So it's not a difficult question. It's an easy one. Alcohol dependence, smoking dependence. These are commonly asked. These topics are commonly asked. Regarding antipsychotics used in schizophrenia, correct matches are. Which are the correct matches? See, this is the question I get. I did not get the 1, 2, 3, 4. I don't know. But anyways, we'll find the answer. So which are the correct ones? Which are the correct ones? First of all, tell me, is this correct or not? 5-HT2 antagonism causes weight loss. Is it correct or not? See, estrogen is cardioprotective because it decreases LDL. But let me tell you, it decreases LDL, but estrogen is not cardioprotective. That is a paradox, right? It increases coagulation factors, and because of which it can cause thrombosis. These are two different things. Now, this is wrong. This is wrong. Why? Because 5-HT2 antagonism, it causes weight gain. It causes weight gain. Muscarinic antagonism treats EPS. It is a true statement. EPS, I've taught you this, right? 5-HT2 block treats negative symptoms. Now see, I'll tell you one thing. Atypical antipsychotics, they treat both positive and negative symptoms, whereas typical antipsychotics, they treat only positive symptoms. And atypical antipsychotics are blocker of 5-HT2 and blocker of D2. Typical antipsychotics are blocker of D2. So you get the hang of it. 5-HT2 block treats negative symptoms. This is true, negative symptoms, because positive symptoms is because of D2. So negative symptoms, these are because of 5-HT2, right? D2 block treats positive symptoms. It is also true. So B, C, and D are true, right? B, C, and D are true. B, C, and D are true. A is not correct. So remember this. What you need to remember, if you don't know, right, add this to your notes wherever you can. Atypical antipsychotics are effective for treatment of both positive and negative symptoms. Typical antipsychotics, they're effective only for treatment of positive symptoms. That's it. Now guys, let's move on to antimicrobial drugs. Antimicrobial drugs, few questions of antimicrobial drugs we'll discuss, which have been asked in the last 2 to 3 years. INI said November 2022. HIV is started on a combined active drug. After 5 months of treatment, he develops hyperpigmentation of palms and hands and soles of feet. What is the most likely cause of this drug? So, pigmentation of palms and soles. Pigmentation of palms and soles. So here, excellent guys. Answer is ampicillin. It causes pigmentation of palms and soles. Zerovodine, it causes pigmentation of nails. So if they ask about pigmentation in anti-HIV drug, ampicillin, though I was surprised they asked about ampicillin because the problem is in India we don't use much ampicillin. We use lamivudine. So it's not a practical MCQ as far as our country is concerned. So ampicillin causes pigmentation of palms and soles. Zerovodine causes pigmentation of nails, right? Remember two pigmentation. Now these were a lot of images were asked in pharma, and believe me, those images were not difficult. Look at this. Life cycle of a virus. Which of the following drugs acts upon step 5? So you can see this is the step 5, right? This is the step 5. Step 5, you can see this is the step 5. Sukhbir Singh. See, edition 7 is not yet to be released. It will be released. And see, as far as pharma is concerned, whatever my edition 4 was, edition 6 it's same. There is not much change. The only thing I change is the drugs of choice or the new drugs. Alright, so what is the answer here, guys? So integrase, which is the integrase inhibitor? Raltegravir. So you can see the Tegra. Tegra is from integrase. So it's an easy one. Similar MCQ was asked in another session. Right, which of the following site 1? So you can see here the MCQ is based upon this site 1. This is an MCQ on site 1. Maraviroc, Zidovudine, Raltegravir, Ritonavir. Maraviroc, Zidovudine, Raltegravir and Ritonavir. Maraviroc, Zidovudine, Raltegravir, Ritonavir. It's a simple one, guys. Attachment inhibitor. Here your answer is Maraviroc. अब भाई एग्जाम में इतना क्लियर इमेज नहीं था तो अब क्या कर सकते हैं बताओ. मोदी जी को मेल करो. Alright, so yeah, so A Maraviroc. So these were image based MCQs, but they are not difficult one. I don't think anyone would be bothered by such questions. Now this is again is not a difficult one. Which of the following statements are true? Which of the following statements are true? This is another question of INS at November 2022. Bedaquiline inhibits mycobacterial ATP. So what is the answer? B. Parazinamide is enzyme inducer. Rifampicin is used only in TB. Isoniazid inhibits mycolic acid synthesis. So what is the answer here, guys? Excellent. C is correct, guys. Bedaquiline inhibits mycobacterial ATP synthesis. True. Parazinamide is enzyme inducer. It's a false statement. Rifampicin is used only in TB is absolutely false. It is used in a lot of infections, meningococcal meningitis, brucella, etc. Inhibits mycolic acid synthesis is true. Now again, would I say it is a difficult question? No. It's an easy one. It's not much difficult, right? A patient presents with high-grade fever, seizure, peripheral blood smear reveals Plasmodium falciparum. What should be used for treatment? Right. Now this is again an easy one. This is also not a difficult one. INS at November 2022. A, B, C, D. What I'm going to use? A patient presents with high-grade fever, seizure, peripheral blood smear reveals Plasmodium falciparum. What should be used for treatment? A is the right answer, guys. IV artesunate. A is the right answer because it's a case of severe falciparum malaria. And severe falciparum malaria, I'll be using IV artesunate for 48 hours. I give IV artesunate 48 hours continuous infusion for 48 hours. I'll be using continuous infusion. Now see, this one is, I don't know even why I'm discussing this. But anyways, this was recently asked. Pyrimethamine plus sulfadoxine plus artesunate is used in. It is used in treatment of what? So I'll not ask for the answer. It's malaria. I don't know if you know that. So I've just included this because it was recently asked. Or आज के टाइम पे भी दुनिया में अच्छे लोग हैं, शरीफ लोग हैं जो ऐसे क्वेश्चन पूछते हैं आजकल एग्जाम में। बस यही बताने के लिए मैंने क्वेश्चन डाला था। राइट, तो उम्मीद मत खोना, अच्छे एग्जामिनर आज भी जिंदा है, अच्छे एग्जामिनर आज भी जिंदा है। राइट, ऑलराइट, एनीवेज, what is the side of action of beta lactams? What is the side of action of beta lactams? One, two, three, and four, five. See, if you look at this question, the marking here in this question, the synthesis goes from, bottom to top. And the way I teach you, it goes from top to bottom, because for me, it is much easier to write it top to bottom than write from bottom to top. Now, here, see here, the first class of drug here, this is phosphomycin, which is acting on the conversion of N-acetylglucosamine into N-muramic acid. The second one, L-alanine, D-alanine, this is cycloserine. Number 3, this is bacitracin, which is acting upon BP, bactoprenol, right? This transglycosylation, this is glycopeptide, that is vancomycin. And this is the fifth one. The fifth one, this is cross-linking. See, upper layer, below layer, and there is cross-linking. This cross-linking is via beta-lactams. It is via beta-lactams. So, yeah. Now, if, see, the same question has been asked again. What is the answer here? This was ionized at June 2021. This was of May 2022, right? June. So, after 1 year, they repeated. Which of the following step does vancomycin act on? Right, now what is the answer here? Which of the following steps does vancomycin act upon? Which of the following steps does vancomycin act upon? Right, so D4 is the right answer. Now see, this image, if it is repeated and you don't know, then how to remember? Now, if you remember by concept which I've taught in the lectures, it is well and good. If you cannot remember, then remember a mnemonic. FC Barcelona has good players. So FC Barcelona, FC is Football Club Barcelona. So, and this would be your number 1, 2, 3, 4, 5. Right, phosphomycin, cycloserine, bacitracin, glycopeptide, that is vancomycin, and P for penicillin. Penicillin and other beta lactams. Penicillin is a beta lactam, all of you know that. So if you know the concept that I've taught you, and if you can find out the right answer, it is good. If you cannot, and if this image is repeated again, and you want to find out the answer, this is a mnemonic that you can use it. So this is just to make your life easier. Next question, guys. A patient is on warfarin therapy. I said November 2021. Warfarin therapy for chronic atrial fibrillation. He was prescribed cephalosporin for RTI. He then presented with hemarthrosis. Which of the following cephalosporin is likely to have caused this? Which cephalosporin might have caused this? Cefixime, cefoperazone, ceftobiprole, and ceftazidime. So this type of questions they have asked. Excellent, guys. So what is the answer? What is the answer? Come on, guys, comment. What is the answer? What is the answer? A, B, C, or D? B is the right answer. Very good. So all of you know there are 4 cephalosporins which have MTT group. One is cefoperazone, one is moxalactam. These are 2 third generation drugs. 2 second generation, cefomendol and cefotetan. So these are 4 cephalosporins which can cause bleeding because of hypoprothrombinemia. So they can ask you which cephalosporin can cause hypoproteinemia or they increase the risk of bleeding. Second, they can ask you which cephalosporins should not be consumed with alcohol taken, or alcohol should be used over those cephalosporins because of disulfiram like reaction, and this would be the answer. These would be the answer. Very good, guys. Very good. नंबर चेंज कर दिया तो भाई देखो, कुछ तो तुम्हारा किस्मत का भी तुम्हारा साथ देना चाहिए ना. 14-old month boy was diagnosed with H influenza meningitis. It is planned to start ampicillin. Later on shifted to ceftriaxone. What could be the probable reason? It is ionized at November 2021. And it is an AIMS MCQ. I know why. Because it was asked in AIMS somewhere around, 2017 or 2018. They had asked in AIMS. So they have repeated the same question. Right. So why he was shifted to ceftriaxone? So what is the mechanism of action? Hemophilus alters PBP sites and hence resistance. Beta-lactam hence resistance. Co-trimoxazole is a drug of choice, but the patient is allergic to sulfur drugs. Easier to administer IV ceftriaxone than IV ampicillin. Excellent, guys. So H influenza produces beta-lactam and hence resistant to ampicillin. And these are beta-lactamases which are called as penicillinases, and that is the reason why this is the answer. If for example, suppose why A is not the answer. If there is an altered PBP, if there is an altered penicillin binding protein, this will give us resistance even to ceftriaxone or all beta-lactams, as it happens in case of MRSA. What is the mechanism of resistance in MRSA? An altered PBP, and that gives us resistance to virtually all beta-lactams. That is what is going to happen. No one can bind. Very good, very good. Antibiotic combination drugs are used in all except. INS at June 2021. It's an easy one, but recently it has changed. So what is the answer, guys? Come on. Gonorrhea, TB, intra-abdominal infection, malaria. Antibiotic combination drugs are used in all except. Antibiotic combination drugs are used in all except gonorrhea. Very good. Remember, gonorrhea currently ceftriaxone alone is used, and ceftriaxone is the drug of choice previously, before 2021, right? In 2020, the guidelines until 2020 was use ceftriaxone plus either azithromycin or doxycycline. But it was found out that there is unnecessary exposure of antibiotics without any extra clinical benefit. So we use it. TB, intra-abdominal infection, it is caused by multiple gram-negative aerobes and anaerobes. So we use mixed antibiotics like Metro with other antibiotics. Malaria, all of you know, we use multiple antibiotics. INI said May 2022. Which of the following drug mechanism has been depicted in the image? Isoniazid, streptomycin, ethambutol, pyrazinamide. What is the answer, guys? Come on, look at this image. Now see, whenever you look at image and you look at a lot of things written here and there, please don't get distracted. Keep your calm, don't lose your cool, and search for anything that you know. Search for anything that you know. Don't get disturbed or perturbed by anything that you don't know. Rather find out what you know. Right? So what is my clue here? What is my clue that is going to tell me here that this is the answer? What is my clue here? See, my clue here is, yes, what is the clue here? Isoniazid is the right answer. See, there is the clue here, the best clue here is, this is the drug which is getting activated by enzyme called as catalase peroxidase. So the best clue here is catalase peroxidase. The best clue here is catalase peroxidase. So guys, catalase peroxidase is the enzyme which converts isoniazid to active isoniazid. We have discussed that, you know that, and from that you can find the answer that it is isoniazid, right? So you have to find your clue. Now see, in the same year, INS at May 2022, they had asked you this question: catalase peroxidase mutation occurs in which drug? Again, what is the answer here? So it's the same paper, right? Same paper, and there are two questions which were similar, identical. So catalase peroxidase mutation occurs in isoniazid, rifampicin, ethambutol, pyrazinamide. And now it's pretty easy. So when you have two MCQs repeated, Now, some people feel good about it, those who know both the answers. And so who feels bad, who does not know one answer, he automatically does not know the second answer as well, right? So, catalase peroxidase mutation or CADG gene mutation, it causes severest form of resistance, and your answer is as soon as it. Next, administration of which of the following drugs would increase the bioavailability of saquinavir? Ritonavir, vitamin C, ganciclovir, cimetidine. Administration of which of the following drugs would increase bioavailability of saquinavir? This is again not a difficult one, guys. Your answer is ritonavir, because ritonavir is most potent enzyme inhibitor, and that is the reason why it is used as a booster. So CYP3A4 metabolizes saquinavir. Ritonavir would block that enzyme in the liver and increase the bioavailability. So it will boost half-life of saquinavir, and that is the reason why it is called as booster. That is the reason why it is called as booster. Very good. Now coming to the last one, guys. The last question, and this question is an easy one. Drug of choice for strawberry vagina. Strawberry vagina. What is the drug of choice for strawberry vagina? It's an easy one. So the questions which are asked in antimicrobials, they are not difficult. If you compare them to the questions of CNS or CVS or G Pharma ANS, antimicrobials, the MCQs, they have been on the easier side. They have been on the easier side. So here your answer is metronidazole. So excellent, guys. This is trichomoniasis. Metronidazole is a frequently asked drug in your exams. They ask you about either amoebiasis or trichomoniasis or giardiasis or bacterial vaginosis. These are 4 conditions which are commonly asked. These 4 conditions are commonly asked. And so guys, your target for next week, endo plus anti-cancer. I've already posted today the topics for this week, endo plus anti-cancer. I've already posted. Go through those, revise those, and don't forget to revise and re-revise what I've told you, right? If you're studying it, then revise, re-revise, overlook, continue that. And with that, we'll be able to, cover well before in advance of your INI set exam. So our aim here is to just, continue our tempo. That is the reason why I'm doing this weekly pharmacology. And sir, can diuretics be used along with digoxin? Say diuretics can be used along with digoxin, but diuretics can be used along with digoxin, and there is nothing to worry about. Why you cannot use? Because furosemide is used with digoxin in case of chronic heart failure. We use it, but you have to monitor the level of digoxin. You have to do TDM. You have to do TDM because change in electrolyte levels like magnesium, calcium can precipitate digoxin toxicity. ड्रग ऑफ चॉइस का लिस्ट कैसे बनाए? देखो, डीओसी का लिस्ट कैसे बनाना है? डीओसी का लिस्ट बनाने के लिए आपने एक टॉपिक रिवाइज किया. टॉपिक रिवाइज करते गए, मैं एक पेज रिवाइज कर रहा हूं. उस एक पेज में मेरे को सपोज तीन ड्रग्स मिले और ड्रग ऑफ चॉइस मिले, तो मैं उसको कॉपी के पीछे अपने लिख लूंगा, कॉपी के पीछे लिख लूंगा. और उसी प्रकार जैसे मैं रिवाइज करता जाऊंगा, जैसे जैसे जिस पेज में मेरे को डीओसी मिलते जाएंगे, मैं अलग से उसी ऑर्डर में लिख लूंगा. और डीओसी लिखने के बाद मैंने क्या करना है, हर दिन सोने से पहले 5 मिनट, एवरी डे 5 मिनट्स बिफोर गोइंग टू स्लीप, जस्ट रिवाइज 5 to 10 डीओसी डिपेंडिंग अपॉन वॉट एवर इज योर श्रद्धा. जो आपकी श्रद्धा है, 5 से 10 डीओसी रोज 5 रिवाइज करना है, 5 से 10. कल क्या करोगे? जो आज रिवाइज किया था, थोड़ा सा अपने आप को चैलेंज करना कि आपको याद है कि नहीं है. आप इमेजिन करो कि फार्मा में डीओसी अगर आपके टिप्स पर है, आधा सरदर्द वैसे ही खत्म हो गया भाई. हाफ ऑफ योर हेडेक इज गॉन, राइट? हाफ ऑफ योर हेडेक इज गॉन. लिडोकेन एंड लिग्नोकेन आर सेम. कोहली बाबू, you have an amazing name. Lidocaine, lignocaine, both are same. Yep. Drug of choice का लिस्ट ऐसे बनाए. ठीक है guys. So that's all. I won't hold you any longer. It's 10 o'clock. Go back, study, sleep, or do whatever you would like to do. And I'll see you guys on next Sunday. Take care. Bye-bye. Thank you very much for coming to this session today.